Here's another case for you. This is a patient who presented with some discomfort on what she thought was number 19. So we grabbed a high resolution, smaller volume CBCT. The 5x5, I think, was the segmentation on the highest resolution we could get to try to evaluate what was happening on number 19. So after looking at it, let me zoom in there on 19. We really didn't see anything going on with 19, but of course we're going to evaluate what we can see in the frame. Let me zoom in here if it'll allow me. There we go. So I didn't see anything going on with 19, but as I looked through the images, let's go back here. You can definitely see something happening around the apex of 18. So she was almost 100% certain that she was having pain from 19, but 19 tested totally normally, and we were able to get an X-ray, this X-ray on 18 to diagnose a periapical abscess here. So this one tested necrotic, so there's no living tissue in that nerve canal there. So really simple case. Patient thought it was here, 100% certain it was here. It was actually there, and I was able to show it to her. And so we did the same thing that I'm trying to do with all my patients, is grab screen grabs to point out, yep, here's your infection right there. There's your infection right there. One thing I would improve on this image is, the blue line is actually this axial slice. I would have moved that, scrolled through here before screenshotting, so potentially we could see some of that PDL widening here that we're not seeing in this image. But these two tell the tale. Periapical abscess that's spreading, widening of the PDL. Again, a necrotic tooth, definitely a problem, needing a root canal and a crown, a new crown. And then, you can also show them there's a giant number of pulp stones in this tooth number 19. There's a good chance at some point in the future we're going to need to consider a root canal based on, the tooth's current situation. It may need, a whole lot of help. But yeah, great case, easy case, slam dunk with a CBCT to help diagnose and identify where the concerns are, and for the patient to be able to see that right in front of their face, and for me to be able to walk them through the image. It's just, they diagnose themselves. I know I've said that before, but they can see it. It's clear what's happening once we explain it, and they move forward with treatment. So what a great opportunity, again, to help this patient.